It's Wednesday night, and we're live from Oakdale, Washington, in the Educated Touch studio. Welcome to Ethics Outside the Box, with your host, Nathan Nordstrom. Special guests include Ruth Warner and you. Here he is, Nathan Nordstrom.
All right. Hello, everyone. And Ruth did not know that she was going to be in the introduction. I actually took your Facebook page, Ruth.
Oh, great.
The picture that I thought you might want everyone to know.
The one that has the Seek Ruth thing in it?
No, actually, I was going for another one. I thought about that one, though. All right. So we're here today together to talk about ethics. And we're doing this every week. So if this is the first video that you're connecting with us for ethics, welcome. There's right now we've got 4 up. We're starting the whole year of 2018 with ethics every Wednesday night at 6 p.m. Pacific time. So please feel free to join us and look at other videos that we've got going on. And we're excited about this because I feel really honored because I've got a person I consider a friend, Ruth Warner, with me today. She is kind of one of those people that always inspires me for several different reasons. One is her work on the foundation and the glories that she has really supported the Massage Therapy Foundation with. Others are her real testament to pathologies and conditions and contraindications, and really kind of reminds me to focus on making sure that I'm doing what's right for the client every time. And so Ruth, thank you for being here with me.
It's my pleasure, of course, Nathan.
Yeah, we're going to talk on a very specific note to really kind of get a better understanding of the NCB Code of Ethics. And so I always want to go back, remember, and can get reminded of where to find all of this. There we go. You go to the National Certification Board's website, NCBTMB.org. Down on the very bottom of any of the pages, I'm going to see if I can scroll down there. It's going a little slow for me. There we go. To the About section, and you find some very important things, including how to volunteer for NCB in different ways, frequently asked questions, and then we have the Code of Ethics and the Standard of Practice. Now, these are the things that you need to know before you say, hey, you know what, I think I want to get board certified with NCB, because these are the things that you're attesting to. These are the things that you're really putting yourself out there to say, this is kind of what I do. And so working with that, we're going to actually come straight back up here. As we've gone through the last couple of weeks, we've gone through discussions on what our scope of practice is and care, healthcare practitioners, and kind of those basic pieces that really start us out talking on the same front. This one does the same thing. It gives us terminology that I really, really appreciate. So number 4 is acknowledge the limitations of and contraindications for massage and bodywork, and refer clients to appropriate healthcare professionals. So I kind of broke this down in several different ways. And so Ruth, I'm just going to start throwing stuff back and forth. Please throw stuff back at me, because I think we can come across a lot of this fairly easily if we naturally just let it flow.
Well, and Nathan, you know, I'm always perfectly happy to throw stuff at you. So
we've done it several times.
Yeah, we have. It wouldn't be the first time. So.
No. So we're glad here to have this relationship. But so the first one that I feel most massage therapists would be uncomfortable with, because they spend time in massage therapy school and they learn about how awesome massage therapy is and how it can help everything and everyone needs massage. And they're starting off with acknowledge the limitations. Mm-hmm. And most massage therapists are, what limitations? Massage therapy fixes everything, doesn't it?
Right. Well, I hope that that's not true. I mean, it's hyperbole, of course.
Yeah.
And one of the things that I do, really probably the center point of my career is I am an educator about pathology for people in the context of massage therapy. And one of the things that I have learned in my multiple decades of doing this now is that there is almost always a safe way to offer structured, educated touch. So actually, before I leap into this, what I'd like to do is sort of lay out a little tiny bit of vocabulary.
Perfect.
Because I am trying now in my 35th or something year of being in this profession to get more disciplined about how I use some of these words. And there was a wonderful paper a couple of years ago, Ann Blair Kennedy was one of the main authors that began to lay out some nomenclature for us that I think is critically important. And in this paper, and I won't quote directly because it's been a while since I've looked at it, but I'm trying to adhere to this standard now. The word massage by itself means well-intentioned rubbing, okay? But not necessarily educated or trained. So, a parent massages their child, a loving couple massage each other, however, well-intentioned touch. Massage therapy is structured, it's educated, it's often goal-oriented. And so the context that I want to put us in is in the context of massage therapy. And then there's sort of a third tier in this nomenclature, which is massage therapy practice, which includes not just what happens in the touching part of the session, but the business relationship and the educational relationship and all the other ways that massage therapists interact with their clients, in addition to what happens once we rub our hands and we take our breath and we first put our hands on our client at the beginning of a session. So one of the conclusions that I have come to in my many years of being involved in this field is that there are very, very few situations in which some kind of educated, structured touch can't be used with some benefit. Now, with some benefit doesn't mean gonna make them better.
Yes.
With some benefit usually means provides a pleasant stimulus for a little while. This is a very good thing. There is nothing wrong with that, right? But when you on your first day of massage school, you learn, if someone has a fever, it's not a good day to receive massage. If someone has varicose veins, it's something you want to be really careful about. You get this list of sort of first line, we call them contraindications. The more you learn, as I'm sure you've experienced as well, Nate, the more we learn, how and when we get to break those rules. So, you can, that's just a truth. But the caveat is our expectation is not about curing somebody's flu. Flu is very much on my mind now. I am working very hard to not get the flu. Yeah, it would be good to not get, pardon me, to not get the flu. Massage therapy isn't going to cure someone's flu. But what massage therapy might do, if it's safe, and there are questions to ask to determine the safety of that, is maybe help that person sleep better that night. Maybe give them some relief from some of the nasal congestion. There's nothing wrong with those goals. So, you opened us with a sort of a hyperbolic statement of what about this attitude that massage fixes everything. I'm willing to go out on a limb and say probably even people in our field don't make a habit of making that claim.
Thank goodness.
Thank goodness for that.
And I like the transition that it's not that it fixes everything, but there's help that can be had by massage therapy.
There's benefit, yeah.
Yeah, and I had a client just the other day who she came in and she got a massage and she then left and came back about a week or 2 weeks later and she said, how come I don't feel as good as I did right after the massage?
Mm-hmm.
And it was a really good moment for me to say, well, what we did was we assisted your body in kind of its main circulatory response. We assisted your body in really kind of helping the posture and helping the resistance that's there. But we can't be there constantly. So that's part of your body's job, to start changing its process and developing a new posture.
Relearning and developing some mindfulness, and some there's a wonderful term that I'm trying to work into people's conversation called interoception, which is developing an increased and improved awareness of what's happening inside ourselves, as well as things like proprioception, where we are in space and what our posture feels like. And massage therapy turns out to be really good at that, because it's a time when, for your 50 minutes or an hour or 90, however long your sessions are, the client's job is to feel their body. We really have no other opportunities in our lives where that's our job for the next hour, is to feel what we feel like. That's a learned skill, isn't it? You get better at it as you do it more and more.
And I think that's why when I was in massage school, I had an instructor.
Way back when you were in massage school.
Back when I was a child. He said that, you're going to be getting better the rest of your professional career. Mm-hmm. But you can't consider yourself adequate till you've touched 1,000 people. That was his marker to say, you're going to be learning exponentially at the beginning, mm-hmm. and getting new experience. And those 1,000 people for him was this magic marker where he said, okay, now you kind of feel like, oh, I've seen something like that, or I understand why that feels that way, or I've seen that in other people. And that really did help me kind of say, okay, wait a second. Once I get to 1,000 people, really that 1,001st person doesn't stop your brain and go, oh, never mind. I guess I don't know. I guess I know everything I need to know.
Yeah, I got this. I don't need to learn anything new. That's not the way to have a long and healthy and fulfilling career, for sure.
Exactly. So I guess my initial statement really comes back to this concept that I see in multiple professions. It's not just ours. It's in a general statement of professions. And it's that statement of, if all you have is a hammer, everything looks like a nail.
Right.
And as massage therapists, a lot of times we're like, oh, wait, you have this condition. Oh, I've worked with that and I've done this, so that's probably going to help. And then you do it, and sometimes it works and sometimes it doesn't.
Yeah. And
so remembering that just because it looks like a nail doesn't mean you didn't see those ridges that mean it's actually
I think you're sort of torturing the analogy a little bit, but
I do.
But I'll go along and say, okay, another thing that massage therapists can do is have more than a hammer.
Yes.
Right? And that's something that people who are newer in the field have a little bit of a head start on compared to geezers like me. So I'm fond of telling the story that when I went to massage school in 19
exactly.
Yeah, I mean it was I think I started in October and I graduated in April or something, and it was, I mean, my first transcript says I have 125 hours of education, and by the end of that I could give a pretty good full body Swedish massage and a little bit of what we call deep tissue, which I would just today call, more specific work that takes time and focus in a way that the dance of Swedish massage doesn't allow for. And we had sort of exposure to things like foot reflexology and a couple of other peripheral things, but just to sort of know that they existed. Yeah. And so that standard, that ethical standard in NCB, Standard 4, where it says we need to respect what we can and can't do, and we need to refer out when that's appropriate, that was especially important for people like me who didn't graduate with training in a lot of different approaches, and so I had just a couple of tools in my toolbox, and now what we have, for better or worse, I mean, there are good things and less good things about the current educational system, but what we do have are people entering the profession with a much broader skill set. It may be less deep in terms of the number of times you get to practice each skill.
Yep.
But you have, our newer colleagues have more ways of approaching a client's challenges or helping a client achieve that person's goals than I had. And I don't know when you graduated from school, Nate, but I think we have some of that in common. Yeah. So again, this doesn't mean, if you have Swedish and you have some, fill in your favorite term for deep tissue and myofascial release and maybe some cranial sacral work and maybe some half a dozen other techniques in which you have some proficiency. We wouldn't say expertise at the beginning of a career, but you might know your way around the protocol. It means you are better able to make safe choices for your clients who might have some more complicated health challenges. The question is, did you get the education in school to recognize when that's necessary? Do you see where I'm going with that?
Absolutely. That's a huge piece. And I'm glad that you brought up the now and then concept, because I worked at a school where we actually introduced orthopedic assessment pretty significantly into the curriculum.
Yeah, I've worked at schools like that too.
And it was so wonderful for me to go, gosh, this is stuff that I didn't learn until like 3 to 5 years into practice.
Right.
And they're getting it right out the gate. And so I can kind of say, okay, you have a patient or a client who comes in and they've got a kink in the neck. What are some assessment tools that you would use to figure out if massage is best, or if you should refer them out to a chiropractor, refer them out to their medical doctor,
neurologist, or a medical doctor, or whatever. Yeah.
And it's so beneficial to keep that at the top of their mind as new therapists, because they'll be able to springboard off of that to the next level, instead of dropping into, oh, well, I don't need to remember that stuff anymore, and then have to pull out as they start seeing clients and going, oh, hey, that is important. Let me go look back in my books and see what I can find.
Right. Yeah, I think that's a nice, and I like that you made a habit of asking that question, right? What can you do with the knowledge you have at your tongue tip, right, your fingertips, to determine whether your skills are the right match for this client or whether they need to be referred onward. Because it's one thing to have several different skills, and that's great, but it's an entirely different thing to recognize when those skills are appropriate or not. And that's where my work as a pathology educator, I think, becomes really important. There's been, and you can shut down this branch of the conversation if you don't want to go down this way, but one of the concepts that we've been tussling with in the profession is the idea of creating some tiered credentialing, so that, excuse me, I'm going to cough just for a second.
Go for it.
So that someone who is really only interested in working in the adjective I like to use is recreational settings. So, doing purely relaxation massage, which is not to say it's not therapeutic. It is definitely therapeutic, right? But they're not looking at working with orthopedic injuries. They're not trying to build a practice among people who are struggling with chronic pain or with health issues. And those people should need a place to practice. And conceivably have less responsibility or less need to hold, a vast encyclopedia of stuff in their heads to do a really good job at what they want to do. And then that there would be a different credential for people who are more interested in working in a way that requires more analysis, and that requires the ability to, you know, to work with some really complex health challenges.
Yeah.
And so, you know, and we see tiered credentialing in some other fields, particularly in nursing. And some of our professions leaders have looked at the nursing model to see, you know, what's a good match, what's not a good match, where does it work, where did it kind of backfire. And you know, and I'm really of two minds about this, because when I was in practice, yeah. So, I mean, you know, when I was in practice, I specialized in working with people who had on-the-job and vehicular injuries, motor vehicle injuries. And I loved that work because I'm extremely linear, and I really love sort of setting goals and saying, okay, how are we going to get to that goal? And if people weren't getting to the goal in the way that I wanted them to, I would get very frustrated, which is one reason I'm not in practice anymore, because I wasn't good at letting people sort of take their own process, and that's not a good skill. It's not a good problem for a massage therapist to have. But my concern is that I am not at all convinced that massage therapists at most levels of expertise in our profession know when it's time to refer out. I've had too many conversations with people who start their sentences, I have a client who, which is why I giggled when you started your sentence, I have a client who. And I love that sentence, right? But I've heard it too many times in face-to-face, and as you know, serving as an expert witness in litigation cases, and in other kinds of settings, where the I have a client who did not have a good outcome, and the massage therapist, through negligence or not knowing enough, so ignorance, assumed something would be safe, and it was not. It was not. And to me, that's a big failure. It's a failure on the part of the therapist. It's a failure on the part of their educators. And to a certain extent, it becomes a failure on the part of the structure of the profession, because you know, we don't have in any kind of way a built-in, I mean, we have these standards, right? This ethical standard. You will admit, you know, you'll recognize the limitations of what your work can do, and when you've hit those limitations, you will refer out, and people say, oh yes, I promise to do that, and still not really recognize, you know, the limits of what they can do and what their clients might need.
So part of that, to me, is the err on the side of caution model that I don't think I ever got in massage school.
Yeah.
I think most of us were so ingrained in the, oh, we're so excited about this, we want to help, and someone's going to come in. My first day when I was in massage school in the clinic, so I had been in for probably 6 months.
For a little bit, yeah.
And so the first lady who came in very twitchy, skeleton-esque, didn't have much musculature at all. That was noticeable, very thin, and was not being able to have a linear thought process as I was interviewing her. And
so I've heard like 3 red flags.
Yeah, and so I get scared, and this is like the first person on my table in the same clinic.
Yeah.
And so I tell her I got to go check in with the instructor just to make sure. I go out to the instructor and I said, so here's what's going on. I don't know if she's taking meth. I don't know what's going on. There's 1,000 things that I just don't know, and I need your help. And she says, go ahead and get started. I'll be in about 20 minutes.
Okay.
And so I walked in feeling behind the 8 ball, feeling scared, feeling like my assessment of something's wrong was not validated. And so I started the massage. And she didn't come in for the whole session. And when I got done with the session, I went back out and I said, you were supposed to come in. She goes, oh yeah, I got too busy.
Oh, your teacher didn't come in for the whole session.
Yep.
That's not okay. That is unacceptable.
And so at the end of the session, at the end of the day of seeing clients, she was going through the evaluations and she sat down with me and she says, this person really didn't enjoy their massage. There was a real problem here. I said, yeah, that was the first person who came in.
Yeah.
And these were the problems and these were the things that I was afraid of. And these were the things that I had concerns about and I wanted to get your insight. And she said, oh, okay, well, we'll just throw that one out.
Oh, jeez.
It hurt me.
Yeah. Yeah, it hurts my head to hear that.
And at that moment, I kind of went, wait a second, there's something better here. There's something that I can learn from this. And that's something that I've tried to take away my whole life is when something goes wrong, something doesn't work right, my brain's not agreeing with something, there's a takeaway to figure out, kind of work with that. And so I took that on myself and said, you know what, I'm going to be able to look up every condition before I start, because I don't want to go into a treatment room, see something, and go, I don't know what to do. I want to be ahead of the game and say, let's work with you on this and let's make sure that we can get the best result.
Right. So I have two things to say about that. Because it's a beautiful example. It's a beautiful example of needing that standard 4 in the NCB standard of ethics. So if you had been able to look up ahead of time conditions, what would you have looked up for her? I mean, you know, she's thin, she's twitchy, and she's not speaking in complete sentences. I mean, that's not enough information to come up with a diagnosis.
On the first day, I didn't even have the full understanding to look up the prescriptions that she was on.
Oh, okay. So she gave you a list of you had a medication list.
We had a health history or a health history form that actually had those medications. I think there were 3.
Oh, interesting.
So.
Okay.
And I didn't even know to do that.
So that would have been yeah. So you went into student clinic having gathered that information and you had no education, no training on what to do with that information.
Correct.
Boom. That's a problem. And
I've learned from that when I ran clinic. I mean, of course, I hope that everyone takes those things and goes, you know what, I'm make sure not to do that way, or I'm going to do something better, or I'm going to engage in a different way. And so for me, every student came up and I had an eye-to-eye, face-to-face connection and said, what are you going to work on?
And
what are you going to avoid?
Yeah.
Are there any concerns that you have about this client? And what is it that I can do to help you most when I come in the first 15 minutes of your session? And that made my students go, oh, well, good. Not only does he know that I know what I'm talking about and what I'm going to do, but he's willing to help me in that session at that moment to improve my skill. And that's what I think student clinics are all about, in my mind.
Yeah, that's like a whole different conversation for us to have. This is years ago. I wrote a couple of articles for Massage Today about student clinics, and it generated so much conversation. And I'm with you. I mean, for my money as an educator, the most important person in the student clinic room is the student rather than the client in that situation, because my job is to serve the student, to make sure that the client is safe, but to make sure that the student is getting what they need, to do a good job and to learn what they need to learn. But I want to go back now. I'm not done with your client. Okay. So let's say we're going to take you back to youthful Nate, and you have some information that you know that she's taking meds. You don't know what they're for. You don't have the opportunity or time to look it up. You're in the room with her. Can you think of a safe way to offer structured, educated touch for a woman who's showing these signs, which is that she seems I'm not crazy about the adjective twitchy. Let's stick with that. All right, she's really thin, she's jumpy, she's really tense, and you're not able to have a good, fruitful conversation with her, right? Can you think of ways that your work could probably offer some benefit while minimizing any risks?
So the biggest thing that I've kind of taken, I think, since then is open, blunt, and kind communication. Because a quick intake interview doesn't always mean you're getting the right information. And so for me, over the years, I may have started with, okay, so is there anything that you're here for? Is there any problems that you have? Are you seeing a doctor? No? Okay, perfect. Hop on the table. I'll be right back.
The most important question got left out of that.
Only one?
Well, I have one. I have a question that has become my most important question, and that has changed over the years. But anyway,
awesome. And so now I actually talk to them about what's going on with their body. I actually changed up the what are we working on today to what's feeling good.
Oh, that's a nice one.
What's going well for your body? What are some things that you feel are positive? And actually, I got that from AMTA keynote speaker, Aaron Akers, this last year. He's a positive guy, just outstanding. And he pushed us to say, you know what, start with the positive. What's going well, and what are you having challenges with that we can help you with? So that reformed a lot of the communication to be, hey, so what is this medication for? Okay, wonderful. Are there any diagnoses that you have that you can share with me? Is there anything that you can't share with me? Because if you don't feel comfortable sharing something with me, I would be more than willing to refer you out so that you can talk to your doctor about it or go to another source. Yeah, I'm willing to ask that question just to make sure that people can say, you know, I just don't feel comfortable with you. Okay, that's great. Let's get you someplace you do feel comfortable.
Yeah.
But yeah, asking more questions and connecting with people.
Well, the connection is absolutely critical. What I heard in your sort of second slew of questions was my new favorite way to begin creating a relationship with a potential client, which is, what do you hope to accomplish, right? Yep. What, you know, and a way that one of my very favorite people who's ever worked with me asked it was, you know, a win for you today would look like what? Nice. So,
yeah.
You know, and I had an extremely specific goal, which was that I was going to be on my feet all day the next day, and I needed to not feel like I had broken glass in my joints. And by golly, you know, he changed what he was doing to focus more on fluidity of movement and not just on being still and sort of sinking into the table for an hour. Because sometimes, you know, I don't know about you, but when I get up off the table after I've been there for an hour, I'm really stiff. And that's the opposite of what I wanted. And, you know, he totally heard that and was able to shift his goals to meet my goals. And so now as a teacher, when I'm working with people as they're creating session plans, because I do this in an online pathology course, you know, for me, the single most important piece of information after sort of establishing basic health parameters is, what do you want to accomplish? What do you see that this time together is going to really bring for you? And maybe it's, I want to sleep really well tonight, or maybe it's, I want to train for my marathon. You know, you would know something about that. So
I would, and I love that concept of really connecting it to what is the purpose? Why are you here? What is it that you want? Because for me, that kind of goes to this concept of indication via contraindication, and I'm pretty sure we're going to go with that.
Oh, good. Okay, yeah. Good. Because we wanted to be sure and talk about these terms.
Yeah, when I look at indication, you're talking about, hey, what is it that you're here for? What would be a home run, or those types of things? That would be the indication for a massage. That would be the statement of, why are you here? What is the goal? What is the purpose? In my mind, that's where indication comes from. And so when I add on to that process in my brain, which isn't always straight. I understand it can be kooky. But in my brain, indications are things that sometimes are difficult, but because of your knowledge, because of your training, because of your experience, you're able to work with specific conditions. You were talking earlier about the more you know, sometimes you can bend some of those rules. You can work in certain areas or certain things. I think one of those great examples is the psoas. When I was new in massage school, there was no way I was going to stab someone in the gut. But I now know that when we're looking at back pain, we can safely work with that muscle in my mind. And so those are one of those things where it's indication, contraindication. And I love that you have a different perspective.
Well, I mean, because my perspective is as a sort of a translator to the medical community. Mm-hmm. You know, I get that you see the word indication in that way, right? Mm-hmm. It's helping someone achieve a goal. But in the context of drugs, for instance, drugs have indications and contraindications. Surgeries have indications and contraindications. And an indication is a situation where the intervention, the drug, the surgery, the massage therapy session, is expected, it is predicted to fix a problem, to fix a thing.
Oh, you said the F word, fix.
I know, you heard me.
Uh-huh.
And so, you know, there are certain circumstances. I mean, what is massage? What are some things that where we can say with some confidence that massage therapy is probably going to improve the situation? I mean, we can talk about headaches in some circumstances. We can talk, you know, back pain. We can talk about, you know, and so to say a headache indicates massage, right, means we can predict, or a tension type headache indicates massage, and we can predict that someone with a reasonable amount of skill is going to be able to help a person have some relief. Okay. And but the way you were using the word indication is a much broader thing. So you know, when I was first using these terms, indications and contraindications, and talking about diseases, and I've had occasion today to spend a lot of time going back into my first edition, which came out in 1998. You know, and it was ahead of its time, and it was the best I could do at the time, and I'm very, very proud of that work. And it is just so, it's just such baby steps compared to, you know, the kind of information that people demand today, which is as it should be. But in those days, we used, you know, something indicates massage if we think massage is going to fix it, just in the same way that we would say this condition indicates using this drug, or this condition indicates that this surgery might be a good idea. And we say that something contraindicates massage if we're pretty sure that massage therapy will lead to a bad outcome, an adverse event.
Yes.
So an acute sprained ankle contraindicates deep specific friction if it's still red and hot and blown up and yes, swollen, right? It's not the time yet to get in there and grind it up. Okay, so that's a contraindication, because predictably we could expect that to have, you know, to make someone want to kick you. So yeah, to lead to a bad outcome.
Yeah.
And then there's this vast realm of in between, where massage therapy, let's go back to our person with the flu. Massage therapy is not going to cure the flu, but it may improve their quality of life for this period of time. It doesn't mean massage therapy the flu doesn't indicate massage therapy. It means massage therapy can probably have a positive influence without necessarily fixing the thing that we're talking about. And in my experience, the vast majority of things that people come to see us for, musculoskeletal aches and pains. Yep. And chronic diseases, right? I need someone to help. I need some help in coping with my, you know, and building some strategies to live with my diabetes, with my MS, with my rheumatoid arthritis, with my whatever. Massage isn't going to fix MS, but massage can radically improve. Massage therapy
Thank
won't
you.
fix MS, but massage therapy could, with skill and good listening and paying attention to the client's goals, very distinctly improve the quality of life for a person who lives with MS. So you see, there's a difference there between saying MS indicates massage and massage offers some benefit to people who have MS. And it's a minor, it might be a really minor sort of linguistic catch, but I'm a writer and an educator, and that's my job. I catch those things.
Well, and the statement, massage helps the quality of life for people with specific conditions.
It can, again, with the caveat of that, I have lost you. I can't hear a word.
Go ahead.
All right. Okay. You cut out there for a minute. So
yes, for a second. Go for it.
No, I didn't hear what you said.
Oh,
so say it again.
So great. You jumped up, so I I lost it. So the key pieces. Just a moment. Let me fix that quality point and this quality. Okay. So massage therapy can help the quality of life of people in specific conditions, in specific pathologies with those challenges. And I think part of that is helping the massage therapist's brain comprehend quality care and quality responsibility and helping, and not that concept of we're the cure for.
Yes.
I mean, because there's very few things that I'm going to say it. We're not going to cure anything. We're not.
Oh, who heals, Nathan? Who's the healer? When someone is having a struggle with their health, who's the healer?
They are.
Yeah.
It's their body that does the healing.
Yeah. So, so we might be able to open some avenues to create some room and some space and some potential. But, the only person who gets better is the person who has the struggle, who has the challenge.
I love the client who comes in and sees you and they say, oh wow, I feel so much better. And when you can turn back to them and say, well, you did the right thing. You went through, and if they've gone and seen 14 doctors and massage therapy is the only thing that's giving them temporary relief, they went through those 14 doctors to find something that could help them. They went to that 15th or 16th thing to figure out what can give them some respite. Sometimes they're seeking for something that may not be possible, but many times it's just giving them that opportunity for them to say, oh, you know what? Massage may have helped. We don't fix, but may help. Go ahead.
Yeah, I mean, it's fascinating. I mean, there are so many different directions we could take this. As it happens, I have spent many, many hours in the past couple of weeks preparing an article for a trade journal that has no circulation in the United States. It's from Massage New Zealand, but it's about new findings in pain science and the biopsychosocial approach to pain management, which basically makes the case that all sensations, but in this case we're focusing on pain, is not a sensation. It's a response to a stimulus. And that response, which is generated in the brain, is the product not only of whatever happened out here in the tissues, but also all of your context about that. Whether anything like it has ever happened before, how much sleep you're getting, whether you have general inflammation, whether you had a fight with someone that you love recently. I mean, all of these things feed into what our bodies feel like, because it's all an interpretation from our brain. And so when we have a client who has visited 15 doctors, mm-hmm. and then they see a massage therapist and they experience some kind of relief, it's extremely unlikely that that's because of anything we did with our hands other than be present with them, and much more likely that happened because we create this incredible, we have this fabulous opportunity where we create a safe space, and it's pretty and it's clean and it smells good, and people look forward to going to it. And I'm setting that up to sort of compare it to, say, physical therapy, where similar goals might be in mind, but would you rather go to your PT or to your MT? right? So, so in terms of helping people have a context where they can experience less pain, where or even just having their pain become less important, less bothersome to them, even if their pain level doesn't go down, if the bothersomeness of their pain goes down. That's often contextual. That's about how we feel in our settings. And massage therapists have an amazing opportunity to help with that.
That feeds so perfectly into, I'm sorry for cutting you off, but it feeds so perfectly into referring out as well.
Yes. Oh. I nodded so hard that my headset fell off. Yes, no, that's exactly, and that's kind of where I was going to go, is that, you know, we have things to offer that a lot of other care providers can't offer because they don't have an hour alone in a trust situation. But because people trust us and they absolutely rely on us to have their best interest at heart, that makes it even more important, even more absolutely vital to know when we have reached the limits of what we can offer. And to say to your client, for instance, here's an example. I can pull one from my own experience. To say to your client, you know, you called me because you were having shoulder pain. Your shoulder pain is not getting better. And in my experience, by now, we should have seen at least some improvement. I don't think I'm doing you any good, and I really think that before we work together again, you need to see your doctor. And she was extremely reluctant, right? Because she had no insurance. This is an older lady. She and her husband would go to Mexico every year to get all their medicines for the year and then drive back up to Utah, you know, whatever. But she did. She ended up going in to see a doctor, and as it turned out, her shoulder pain wasn't shoulder pain. It was an infected gallbladder. And you know, I mean, I was no genius for saying, I don't think your shoulder pain is really shoulder pain. I was just being honest and saying, by my experience, this isn't progressing and helping you meet your goals. My skills are not what you need. You need to look to someone else.
One of my favorite examples of that is something that massage therapists get all the time. And that is, you see someone's back more than they see their own.
Oh,
back.
yeah.
And being able to see a tumor or some growth that's going back there, or something that's on the
back, funny mole or whatever.
Or a mole. And the number of massage therapists that I know who have sent their client to the doctor because that thing doesn't look right is high.
Yeah.
And I am so grateful to see that patients who are willing and excited to say, thank you for sending me. Yeah, it wasn't cancer. It was just a mole, but I did get it removed. And so thanks for keeping me in mind and keeping your eyes on my back.
Yeah.
It's one of those tools that we kind of have that doesn't get taught in massage school enough, in my mind. I know there are some massage schools where they are teaching good assessment of different tissues and what a good mole is and what a bad mole is. I don't think that's even our job. If we're seeing something and we mark it, and that's why soap notes are so important in my mind, as well as many others. Hey, something's here, it was about the size of an eraser, and then you see them a month later, that's not the size of an eraser.
Right.
Refer. And that helps.
So I am a columnist for Massage and Bodywork magazine, which is available. They make it available for free to everybody. You don't have to be a member of ABMP to access it.
Awesome.
And my next article that comes out next month is based on a long interview with a public figure in our field, Jan Schwartz. You probably know Jan.
Oh, damn, yes.
Yeah. So Jan's at the hairdresser, and her hairdresser says, you have some marks up here that I've never noticed before. You might want to get that checked out. And it led to a long and very complicated and ultimately potentially life-threatening situation for her that she was very, very generous to share. And I just loved that language. It wasn't her massage therapist who saw it. It was someone else. It could well have been. But the language was, I see something here I haven't noticed before. Or as you said, I see something here and it looks different from last time. It's different from saying, wow, nice basal cell carcinoma you got going there, fella.
Or running around the table with your hands in the air.
Yeah, no, that's not appropriate. Obviously there are some rules, and that's a different ethical standard that you'll probably have a different conversation about with someone else. But that also, what we're talking about also comes back to standard 4, which is about referring out. I feel reasonably confident that massage therapists are knowledgeable enough. They might stumble a little bit with verbiage, but they're knowledgeable enough about what they observe visually about the skin to give people good advice, about tracking changes in their skin. I am less thrilled or less confident that a massage therapist might know that, for instance, if someone has diabetes, they may have reduced sensation in their feet. And so this is not the client on whom we're going to dig in and grind up the calcium crystals, or the uric acid crystals or whatever. First of all, don't do that.
No.
But secondly, if someone has reduced sensation, doesn't mean you can't touch them, but it means we need to not be trying to change the quality of that tissue, because if there's reduced sensation, they can't tell us if we're overdoing. Yep. And I'm a little less convinced or a little less confident that massage therapists who have clients with complicated health situations are always aware of some of those subtler decisions that is our responsibility to make.
So, I guess for me, one of the bigger concerns in that genre is that, yes, if we look at the mass of massage therapists, I've told this story probably the last 2 weeks about I worked in a spa for a couple months back and had a patient who had cancer. And if we really separate out this spa therapist, massage person,
recreational setting, right?
And this treatment-based massage therapist, that cancer patient is still going to be going to the spa.
Yes, thank you. That was actually, you're absolutely right. People with cancer, people with diabetes, people with complicated health situations, they go to the spa, they go to the resort.
I was glad to have him, because I could then refocus, refunction the treatment plan for him on the fly.
Right.
Now
but if he had ended up in a different therapist's room, possibly not.
Exactly.
And it's not his job.
No.
Right? It's not his job to say, I need someone who's got some experience with oncology massage therapy.
Correct.
That's another problem I have with the tiered system, is that it's not our client's job to know who's the right person to go see.
So the other piece is education versus continuing education. I know that massage therapists like hands-on classes because they get something new that their hands can do, a special hoodoo magic thing, and yet they don't want to go and sit in a lecture class about diabetes.
Tell me about it, Nate.
Well, in my mind, that is, if you take all of the diabetes patients and cancer patients in the world, let's just go with America.
Yeah.
You're going to hit a huge chunk of the population.
29 million people, almost 10%.
Yeah. So let's see, you're cutting your success rate and the damage that you probably could cause to that 10%. I would much rather cut down the injuries that I would cause to a group.
Yeah. Well, I appreciate the push for good pathology-based or conditions-based continuing education. And
You're welcome.
you can edit this out later if you like.
Go for
But
it.
I am actually in the process of developing, it'll be a pilot course, a 3-hour CE course specifically on diabetes that will be available online. There will be some interaction directly with me, but but most of it will be activities that people will do to create some better depth about our understanding of diabetes. And I hope to follow that up then with probably about a dozen others. We'll see how this first one flies. So thank you for letting me do a little plug. And if you want to, use that as your cutoff point, then you can edit out that bit.
But the key point is that someone's doing it.
Yeah.
And I want to see that happen more. And yes, Ruth, you're doing it, but I don't doubt there are other people doing it.
There are, and they're really good.
Yeah.
And I'm really glad to see people attending these classes about pathologies. It's as it should be. And
giving you a pat on the back and props, because when I go to a conference in fill in the blank state, and you're teaching, my hands-on classes are dwindled because your pathology class is halfway maxed out. And I appreciate
not usually
that.
The way it works. So.
Yeah, sometimes, because you have a name that is synonymous with really pathologies, contraindications, and people are starting to kind of go, you know what, it's important for me to know, or I have a patient who has this,
right,
or a client who has this, and she's going to be talking about that, and so I really want to connect with. And that's beautiful to me, to kind of look at the trifecta of different types of continuing education there are out there, because it's needed to really kind of connect with pathology and contraindications. So thank you for doing it.
Right on. My pleasure.
We're running up on time, and so I just kind of wanted to go back to those three major things. That it's important for us to recognize our limitations as a massage therapist, that we're there to help the health of the body, and remember that they're the ones who
improve quality of life.
Improve the quality of life, exactly. Knowing our contraindications. If you were one of those students in massage school who, when they were going through pathologies and contraindications, and you just felt your brain going to sleep, it's a good thing to revisit, to kind of go back in and really kind of, now that you have hands-on experience and you're like, oh, that's right, what was it that I was supposed to know in massage school about that? Revisit it, because that's an opportunity for you to know your contraindications, because you're expected to be able to apply them. And then refer to other healthcare providers. And one of the biggest things that I think of when it comes to referring to other healthcare providers is being able to network with the other healthcare providers in your region.
I'm so glad you brought that up, because I was going to do that as well. Is that, I think if you are a regionally based massage therapist and you've got your practice set up in especially if you're working in a good sized town or city, one of the smartest things and most ethical things you can do is to create a network of referral sources, so that you've got maybe a couple of primary care physicians, maybe a neurologist, maybe someone who whatever your special group of clientele is. If you work mainly with older people, then you'd want to have some gerontology specialists on your referral list. But because our clients trust us, it's we're in a wonderful position to give them good advice. And one of the things we can do is to seek out the healthcare providers in our communities that we feel are going to be the good matches for our clients.
And there's a lot that are out there that are willing to talk to us.
Yeah.
But you have to do the uncomfortable thing of first stepping out and saying, hey, I'm a massage therapist in the area. I have clients who are looking for this. Could I talk to you, or do you have a few minutes so we could talk?
So, Nate, there's an ebook at the foundation. So at www.massagetherapyfoundation.org, there's an ebook that Laura Allen wrote called How to Connect with a Physician. And it's, it's short. It's like 20 pages. And it comes with a couple of sample letters, like form letters that you could turn into your own to reach out to primary care providers or other kinds of care providers, specialists in your area to begin sort of knocking on the doors and building relationships with the people with whom we'd like to have a good working relationship, so that we can be observant of standard 4 and refer out with confidence that our clients are going to get good care.
Ruth, thank you once again for joining me tonight.
Thank you, Nate.
Just wanted to make sure that everyone knew, if you want to have this hour of this YouTube video that you watched, you'll need to take a test. You can go to educatedtouch.com.
Yeah, I'm not writing this test.
It's already done, thank goodness.
Okay.
And yeah, so we really do want people to remember the importance of contraindications and being safe and referring to the right place. Standard 4 is a really good way for us to stay connected.
It was nice to meet you, Ruth Warner. Thank you, Nathan. The hour has flown by. We hope you've enjoyed this discussion with Ethics Outside the Box. As you've seen, Nathan uses many second-hand stories of ethical situations. If you'd like to share your story or you have any questions, feel free to contact him and Nathan at educatedtouch.com. If you'd like to register for next week's live webinar, go to shop.educatedtouch.com. Under live webinars, you will see all upcoming webinars. If you have just watched this video and would like continuing education for home study, you can go to shop.educatedtouch.com under the home study options with the date or episode number to receive your exam. If you would please like this video and subscribe to our YouTube channel, we will keep you up to date on new videos. If you'd like to attend one of our live courses, you can find upcoming scheduled events at www.educatedtouch.com. Thank you for joining us today. Be well and have an ethical day.
Thank you, Lulu, and have a wonderful day, Ruth.
Okay, thanks, Nate. Always good to talk to you, and I'll see you in Kentucky.
Wonderful. Yes, you will.
Okay.
All right. Bye-bye.
All right.